Morning, everybody, and thanks to everyone for joining us today to discuss this topic about managing health and well-being of your employees, particularly during this very challenging COVID time, which I know is something that is relevant to, of course, all employers at the moment. As most of you know, and some of you come along quite often to our regular monthly HR Matters sessions, which of course we normally hold in the Manchester office in partnership with the Chamber of Commerce. Of course, like everything at the moment, we've switched over to Zoom for today, and hopefully the technology will be kind to us this morning. So for those of you that have not met or spoken to before, my name's Matt Fraser, and I'm a lawyer in the employment department at Freeths. So I'm going to be talking about some of the legal challenges around this topic today, the rules and regulations, what you can and can't do with employees and what you should be doing. And I'm very pleased to be joined today on the webinar by Julie and Nicola from Working to Wellbeing. So Julie and Nicola, if you'd just like to introduce yourselves.
Hello, hi, I'm Julie Denning.
Hi, I'm Nicola Suckley from Working to Wellbeing.
Great. And then we're also joined today by Sam from Working to Wellbeing, who's going to help out, just making sure it all runs as smoothly as possible.
Yeah, morning everyone. So I guess just to start with, Rebecca and I will be kind of, in addition to Matt, Nick and Julie, are kind of helping with the smooth running of this. And if you've got any questions, just hit us up. There's many ways you can get us. If you've got a question, you can use the Q&A. If you wanted to chat, then you can use the chat on the bottom of your screen. But I guess the first thing to do is to just make sure you can all hear us. So if you can let us know via the chat, if you're having any issues technically, that'd be great. You're all on mute for the time being, but you can use the Q&A box on the bottom bar to ask any questions. We have got some that have been sent in already. But yeah, please feel free to interject at any time if you wanted to kind of ask anything on that stuff. And with regards to the session itself, it's being filmed. So we're going to be able to share all the slides afterwards. Rebecca will give you some idea of how long that will take at the end. And yeah, like I said, this session is interactive. So please feel free to ask questions and to interject at any time. What will happen is you use the Q&A bottom at the box at the bottom, and we'll then notify Matt, Nick and Julie of the questions and try and fit that in wherever we can. But we'll try and accommodate everyone's questions should you have them at some point.
Okay, so just a bit about us, and I know a lot of you are already familiar with Freeths, and we've got just on the slide there bits of information about who we are, what we do. We're a national commercial law firm, so all service law firm, usually operating from 13 offices, although now we're operating from about 800 rooms and bedrooms across the country. And as I say, I'm an employment lawyer at Freeths, and we provide advice right across the range of employment and HR topics, and of course, you know, at the moment are focusing pretty heavily on supporting businesses through the particular challenges that COVID is throwing up for everyone at the moment.
Yeah, brilliant. Okay, so I'll introduce ourselves. So we're Working to Wellbeing. We're specialist providers of vocational rehabilitation services and work and wellbeing support services. Our specialism is in helping people with long-term conditions to either remain at work and self-manage their condition, or to be able to get back to work when ready. As a company, we're underpinned very strongly by both a psychological and a physical focus. My background is in health psychology, and I'm also a CBT therapist, and Nick is an occupational health physio, and that philosophy of physical and mental health permeates all of the work that we do. And all the interventions that we design are all evidence-based, enabling people to manage their condition. We've also been given several accolades as an award-winning service as well, so we're very proud of what we do. Okay, next slide. Okay, so in terms of what we're going to be talking about for the next sort of hour and a half, is to focus on the mental and physical health of your employees during these challenging times. What we're wanting to try and do is to support you with how you're going to enable people to stay well if they're on furlough, to stay well if they're when they're working from home, and how you're going to help people transition, as we're doing at the moment, that's starting to transition either back into the workplace or as the working practices are changing. And we're going to be hearing from Matt about sort of the legal underpinnings of this work as well, so we can kind of understand exactly what your requirements are and what you need to do, and then we'll be saying and how you can do that. And focus on that. So we thought it would be quite useful just to show you some evidence, and this has been evidence that's been being carried out during the last 9 weeks, and the survey particularly by the Institute of Employment Studies was being done throughout April and finished at the end of April, and they were finding that people were reporting increased aches and pains in the times that they'd been working from home, and that included neck pain, shoulder pain and back pain. There's been an increase in alcohol consumption, so 1 in 5 of us are drinking more alcohol during this time. We're eating a less healthy diet. There's probably lots of picking food going on, lots of comfort eating perhaps, as there's also been an increase in low mood and anxiety. In spite of being able to go out once a day and now more frequently, people are actually exercising less, and actually their sleep is being affected too. And that's mostly attributed to worry, in particular financial worry during this time. And also they're noticing an increase in fatigue. We've heard in the press about Zoom fatigue, sorry folks. We've also heard about just fatigue generally from deconditioning through lack of exercise, and also that concentration waning. And it's interesting, this last point about people reporting long and irregular hours, which we'll come on to later, about how people are actually managing their time, is also quite challenging for them. And then if we go to the next slide, it shows data from the Office of National Statistics, and they're always generating new information that's coming out, and that was very closely mirroring what the IES had found. And again, 53% were reporting that this period of pandemic was affecting their well-being, and 47% were saying they're experiencing high levels of anxiety. 4 out of 5 were saying it's affecting their finances. And the way people are coping with that, which is really useful because we know that social support is a buffer for mental ill health, is that they are actually staying in touch with friends, and that they're doing that remotely, as that's all we can do, but they are making use of technology in order to be able to connect. But their main concerns, and I think this is echoed in the general press as well, working from home, fears of redundancy, which I worry we're going to start to see increasingly, closure of someone's own business, let alone the employer that they're working for, that necessity to work extra hours to keep the business going, and that sense of taking leave and holiday. You know, what's happening with holiday? Are we allowed to take holiday? Should we be taking holiday? I don't really want to take holiday. What's the point? That whole concept of taking holiday and annual leave is really important to people. Okay, over to you, Nick.
Yeah, so in terms of how this is then continued to progress, and more recently, certainly from a clinical perspective, that we're hearing more about in terms of our roles within this, now that the acute management is obviously ongoing, but we're now moving into this kind of rehabilitation phase. We wanted just to note, to touch on this today, because it is definitely very relevant for employers to be thinking about when supporting people back into the workplace. Now, within this, there's sort of 2 areas to be thinking about. So we've got the general employee population. So those who have potentially just been working at home, or they may have been furloughed, we need to be thinking about potentials for deconditioning, general deconditioning. So all the things that Julie's just sort of described that were found in the various studies that have been carried out, is how we're going to sort of think about the implications of that when trying to support people back into the workplace. So that's one population, and then the other population is actually those people who may have suffered from COVID-19, because they will very much need a very specific rehabilitation to support them, particularly thinking about getting back into work. Now, what we know is that this is obviously already happening, because there are people that are obviously coming out of hospital and they are getting back home. But what we would typically pick up within the work that we do is that very often people do receive very good treatment, and they do get back to a relative functional state after a sort of quite impactful kind of condition. But very often work is not a focus of rehabilitation within that, and that's the sort of population that we typically pick up, because we would be helping support those people to get back into work. So what we're sort of really trying to promote is that the rehabilitation that is taking place is very much thought through all the way to the point of getting people back into the workplace. So it needs to be work focused. If we've got people that are going into very sort of high demanding physical jobs, so perhaps within construction, for example, we need to be thinking about looking at the job demands of their individual roles, and making sure that the rehabilitation is sort of appropriate for them as well. So this is where you may want to be talking to more specialist services within occupational health to support that, and certainly the Occ Health physios would fit into that role. But we also need to certainly be thinking through kind of the both the mental and physical health perspective of this, because there will be potential for, they're describing as a type of PTSD for people that have gone through this as well. So we need to be thinking about both within that whole sort of rehabilitation process. Okay, so really we wanted to sort of summarise our reflections in terms of what we've seen with managing our sort of patient population during this period, and working with our clients to understand sort of what the key priorities need to be. And this has helped us to sort of formulate some of the discussions for today as well. So obviously we're aware that people have had to adapt to a new working condition, and this is obviously have had and potentially still having an impact on both their physical and mental health. We know that people with long-term conditions are having some support services put on hold. Now, we know there is a movement for that to restart, but obviously there's going to be a backlog. So it's really important that we're having those conversations with employees if we know that they have long-term conditions, to understand that they're still receiving the appropriate support that they need. That people that are on furlough are also at risk of becoming deconditioned and suffering from low mood, and that's because we know that good work is good for our health, and so it's really important that we also still implement some of these support services for those people that may be on furlough and potentially could be on furlough for quite a period of time. I've touched on this already around the rehabilitation of the workplace post-COVID, so we need to be thinking about the two different types of populations, for the general deconditioned, but also those COVID specific, and thinking about fatigue, trauma, emotional responses, physical deconditioning, and looking at specific job demands and capability. And then Matt, you just popped this one in as well, didn't you?
And just from a legal perspective, I think so right across those points, then employers just need to be aware that this the need to proactively support staff during this time. So with employers, regardless of where the employees are, if they're working from home or if they're in that transition period back into work, then they still have the duty of care towards all their employees, the duty to protect their health and safety, and then special duties to make reasonable adjustments towards those employees who maybe have a disability as well. So, just to sort of highlight really that the employer's duties towards employees, continue through this time, and the need to take proactive steps, as Nick has outlined there, really.
Yeah, definitely. And I think one of the key things that will come from this is, as much as we'll be talking about what we should be doing, it's very much about sharing that kind of best practice, so that it's almost a preventative measures. Okay.
Okay, cool. So moving on to the questions now. If anyone has anything burning they want to ask, then they can, again, I'm going to sound like a broken record here, but use the Q&A box on the bottom of your screen. But yeah, if failing that, we'll just move on to the first question. Okay, cool. So I'll ask both of these. So the first, an employee is experiencing increased neck and back pain whilst working from home. What should I do? and I've noticed I find it hard to switch off at the end of the day. What can I do?
Okay. Well, I'll just start with this one, with the first question. And really, we grouped these questions together because they were the things that we were hearing more so when people were perhaps in that initial stage of lockdown. But it's really important that we still touch on them because people will still potentially be working at home, and these are things that people may experience at various different times. So in terms of the kind of musculoskeletal sort of complaints that people may be having, I think it's important to understand that when these are new, it's not because we have established sort of injuries per se, but it's also that we're just actually getting used to a new way of working. Now, there will be lots of discussion about ergonomics and the best desk setup, and absolutely, this is an important thing. But I think the most important thing that you should be sort of promoting with employees is that people basically don't sit for long periods of time. So that whether that's sitting, standing, it's important that we just keep changing position. Okay, so there's a saying about sort of your next position is always the best one. So please encourage employees to be getting up, moving around, even if it's just a couple of minutes, go make a cup of tea, come back. But by changing position regularly, that will stop this kind of build-up of musculoskeletal complaints. Now, that is relevant whether somebody's working at home or whether they are working in the office. And then in terms of anything else, in terms of general advice that you can provide, yes, it is good to be kind of creating a good sitting position if we can. So encouraging people to ensure that they're using, you know, the chair and table in the kitchen rather than slumping on the sofa. Try and have a screen that is sort of raised up, so at least they're in sort of more of a neutral position. And all of these things can be done at relatively low cost just through wireless keyboards and a wireless mouse and a couple of textbooks is always a good way of establishing it. You may want to think about this as if we progress and if things change for you as an organisation and people actually do start working from home on a more permanent basis. And I'm sure Matt can kind of talk about that a little bit more from a health and safety perspective and what your obligations are. And I know that quite a number of assessments are being carried out remotely. They can be done, but like I say, in some respect, that's because it's just general advice. I think we need to take out some of the urgency around this and actually get people to look at their work style more than the amount of priority that we put on the actual kind of ergonomics. If you want any more sort of information about this, if you go onto the website for the Association of Chartered Physiotherapists in Occupational Health and Ergonomics, which is ACPO, they have a really nice document that you can download, and it basically summarises all of this information, and you can share that freely with employees.
Yeah, as Nick says, I think it's a developing situation, and of course for those employers that, if it's going to be a really long-term position that you've got employees working from home, then the point about the risk assessment, I think, becomes even more relevant from a legal perspective. At the beginning of this, we were getting lots of queries about should we be doing a risk assessment for everybody before sending them home, but then of course events have overtook that really. And I think most organisations have taken quite a pragmatic view that really, as long as you're thinking about the points that Nick talked about and communicating those with employees, then in the short term that tends to be sufficient. But obviously as we go forward, as Nick says, there is kind of more emphasis, there's going to be more emphasis on assessments and on remote assessments. I think it just is one of the questions that's coming about things that we're getting right, or examples that employers have got right at the moment for employees. And I think that links into this question because one sort of immediate thing that employers can be doing is getting some of the points that Nick talked about in terms of having frequent breaks, getting away from your workstation, moving positions into a format that all employees can see. So just to give an example from Freeths, then we have bulletins each week which talk about those kind of things, we had an online sort of e-learning module that everyone across the firm had to complete, which gave little, sort of cartoon figures and examples of, that sort of thing, just to try and kind of make it kind of accessible and appeal to people. So, without the sort of obsession about very sort of formal risk assessments, then, there, even before we get to that point, there is, lots that employers can be doing to make sure these points are picked up.
I completely agree with that, and that's one thing that I'd really encourage. Is I think we often very much jump to very quickly to the working environment being the problem, being the workstation, and we don't look actually at the work style of the individual. And it's the employee's responsibility to manage this as much as it is for the employer. So if we can balance both, I think we'll get a much we'll get a positive outcome from it. And there's lots of resources, there's lots of apps that people can use as prompts and guides to kind of encourage movement. And as an organisation, you can put things in, whether it's utilising diaries or encouraging, if two people are working together, can one person go up to sort of a walking meeting, that type of thing. So there are lots of things that we can do to get those things in place.
And the only other just brief points I just wanted to flag on this is, of course, thinking about employees that you might have who have a disability. Because whilst we've got a duty towards all employees, and as I mentioned towards the beginning, we've got as employers particular duties towards disabled staff. To make reasonable adjustments for them, and that doesn't stop just because they might not be on the particular work site. So we've got lots of queries from clients about particular support that they can give to disabled employees. So maybe they've got a chair that they use that's been purchased at work, to explore whether that could be taken home, that they could be using at home, or perhaps considering purchasing a new one for them. And that duty is a bit different or more extensive than for the wider employee population. So it's always worth bearing that in mind, that duty doesn't stop just because people are working from home.
And if any form of assessment needs to be done, economic assessment, then these can still be carried out remotely. It's just done in a modified way when we work with the individual, but that's no harm with that, because it actually involves them more in the assessment and they take more responsibility for it. And actually, hopefully, they potentially learn a bit more about their workstation setup. And it really allows us to have that conversation about their responsibility with it as well. So, okay.
But I think it's also worth reminding, this is a behaviour change. And if you want people to make those sorts of changes, you're going to need to reinforce that messaging quite frequently. You can't expect just to say, right, we've got, it's brilliant to have e-learning stuff and to have information and have all the resources, but you need to know that your people are interacting with those resources. And that probably is going to come down to line manager support and just checking in and saying, have you been getting up and moving about? Have you been doing the adjustments you need to do according to our policies and procedures, or however you want to frame it, but it's enabling that communication, that constant messaging. It takes something like 7 or 8 times of hearing something before you want to do it. So we just need to check in and reinforce and support people, because this is a new way of working, and we do need to make those and support people to make those adjustments and learn fairly quickly how to do them, so that we don't have unhelpful behaviours becoming habits, not the healthy behaviours becoming habits. So we just need to keep an eye on that. And that sort of ties into the next point in terms of thinking as well. How do we help people to switch off? And I think that also comes in a little bit of employer responsibility, obviously the employee responsibility. But for example, if you've got a line manager who technically should be finishing work at 5:36, normal working hours, but is still writing emails at 7, 8, 9 o'clock at night, and you've got someone working from home going, crikey, they're working from home, I'm working from home, we should be doing what they're doing. Just be really mindful as a line manager of what behaviour you're modelling. So a bit like Nick said just then, you could go and have a walking talking meeting. If you are modelling that, then people will be much more likely to adopt it, because they will say, oh, he's doing it, it's allowed, it's okay, I'll do it too. Or she closes down at 6 o'clock every night, I'm going to do that. Even if as a line manager you do need to do some extra work, for argument's sake, use your Outlook tool more efficiently, do the delay respond, write your email at 8 o'clock at night, because maybe you've got children, maybe you've got to shift the way that you're working, and just get it to send at 9 o'clock in the morning. I think it's just really important we start to use the tools that we've got, the tech tools we've got, to our advantage more, and to help to support people during this transition. And that's switching off at the end of the day. We can help people to say, right, we'll just, wherever you're happening to be working, actually physically close it all down, get a box, put it all in a box, put the box under the stairs, just find a place for it, so that when you walk back into that room, so for example, we know lots of people are working in their lounges or their kitchens, that the association still stays clear. This is my kitchen now. It's sort of 7, 8 o'clock at night. It's not my workplace. And if you see your work lurking, it doesn't take much to go, oh, I'll just check that email, or I'll just finish that paperwork. The cues are there too much. So finding people, little tools and techniques of behavioural changes as well. Again, so you don't start getting into bad habits. That the ironing board's up with your computer up perpetually, or it's your laptop's always on the dining room table. It's just finding ways just to make that transition. And another way of doing it is, for example, you're downing tools at 5:30, maybe go for a walk. So take that separation, find that way of breaking the cycle of work to home, because it is really difficult. And I work from home all the time, but I am finding it harder having 4 more people in the house with me. It was just me and the hound, and now it's not. And so I can go from my office into my kitchen, and I've immediately got to go from work Julie to mum Julie, and that's the transition. So if I just stayed down tools in my office, stayed there for 20 minutes, half an hour, just do something else, reposition, and then go back into my family life, that transition can be made just more easily, rather than just helping my brain really having to go from one state to another state really quickly, and managing that challenge.
I think we've seen that work very well with clients when the messages come from senior people about that it's okay to do all those things that Julie has just talked about having that separation and switching off at a particular time, because as you say, that it's people feeling the pressure that other colleagues are doing it, and particularly during this very uncertain time, as I outlined at the beginning, the anxieties about what's happening in the businesses. Are you going to be furloughed? Is redundancy coming? Everybody's concerned. So having the message from a senior level. And then I think also just employers thinking about the usual rules about taking breaks, so the working time regulations and the break policy that you have in your own companies about how many breaks people are entitled to, depending on how long their shifts are and how long the rest between working days is. That all still applies. So if those are breached and the employees are able to show that actually the employer has taken no steps to try and preserve those breaks, then that becomes an issue for the employer, and of course it's not good for the employees either.
But and I think that also goes back to the cons, because in an office environment, it's really easy to see who's moving, who's taking breaks, who's doing what. Not from a big brother point of view, just from a human behaviour point of view, an observation point of view. You can't do that when you're working from home and the other person isn't there. So that's why you have to start talking about it. Have you taken your break today? Have you moved around every 50 minutes? Have you got a little sticker on your desk? Have you got a reminder to move? You need to be asking people to do that. And we see that all the time in the work we do with supporting people with long-term conditions, because we've often had someone working from home. We've had to support a line manager who's supporting someone working from home. And there just has to be that raising the bar really of dialogue between teams and team members. But I absolutely agree with you, Matt, in terms of the senior leadership role. Certainly in the wellbeing literature, it's very well documented that if you've got your CEO and your senior directors on board with any behaviour change, any wellbeing initiatives, the absence management, any policy across your business, if they are living it and doing it and working it, it will filter down. And that role modelling, that normative element is incredibly powerful. And I think more so than ever now, it's important to get that messaging out and people are hearing it, that they feel safe, psychologically safe, that it's okay. They're not going to be penalised for getting up and walking around. In fact, we should all be getting up and walking around. It's important stuff.
Great, thanks, Julie. We've had a couple of questions actually that are kind of leading on from these questions. So I'll just ask them to you now. So if, as a business, we decide to allow staff work from home more often than is legally responsibility of the company, how can an employer protect an employee in their own home? Would there be an element of responsibility on the individual themselves? Will I have to buy staff member a desk, chair, full office setup? Who wants to take that one?
That feels more legal, Matt.
Yeah, definitely. I think there is absolutely, as we say, a responsibility on the employee themselves, and at the moment, we would say that there's no obligation to be buying everybody who's working from home a chair or a desk or anything like that. Obviously, if this, it all depends on the business, the individual employers, and how things move forward in the future, and if it's going to be a permanent setup, that there's going to be a working from home states that employers have, then at that point, then I think it needs to look kind of more carefully about what equipment people are using and what their permanent setup is going to be, and if there can be some support for that. But as we've said, there is a sort of mix of duties there on both sides, and employees certainly have their part to play in terms of making sure they're sitting in the right position at the moment, in as comfortable a chair as possible. As we said, getting up and moving around, and employees can encourage that through the communication and then monitoring what they're actually doing as much as they can.
Yeah, completely agree.
Great, thanks, Matt. And then again, on the similar kind of theme, we've got a question which is, how can an employer control when employees work when working from home? So we all know that staff will not work to full productivity during the day, but might catch up in the evening or weekends. What is the liability on the employer for this? Can an employee claim overtime if they are sending emails and working outside traditional office hours?
Yeah, I think again, a legal one, isn't it, really? But I suppose the starting point is that we should try, so far as possible, to work out with employees what their structure is going to be during the day. So if the arrangement is still going to be that they're working their usual contractual hours, if that's 9 to 5, then if they're deciding to send an email in the evening, just occasionally, then no, they wouldn't be entitled to overtime for that. However, as we've said, we should be trying to discourage that as much as possible, but we all know realistically that occasionally will happen. But if it's becoming more of a trend that actually, as Julie says, maybe because of childcare reasons or other considerations, that someone actually finds it easier to work during the evening and have a proper chunk of time when they are working during the evening because of childcare responsibilities during the day, or maybe for an elderly relative or whoever it might be, you could discuss with that employee whether there's going to be some flexible working arrangements at the moment, where there's a bit of a change in what their expected working pattern will be. So they still work, if they're due to work 6 or 7 hours a day or whatever they're contracted to do, you'd maybe just split that up differently through the day, so that they're supported and they can also help relatives perhaps. And I think overall that should improve the balance and make sure that they're actually more productive at the times that they are working, and then you don't get into issues with overtime.
Yeah.
Great, thanks, Matt. Anything to add to that, Julie? Nick?
Yeah, I think so. For me, it's about planning, and it makes me think of return to work planning and phased return to work planning. It's a similar sort of concept, really, and it comes down to knowing your staff. Do you know whether your staff have children? How old those children are? Do you know whether they are responsible for caring for an elderly relative or someone who's shielding? And these aren't probing questions like I must know everything about you in a super sleuth way. It's more about just understanding the people you're working with and actually knowing that, hang on, why is this person always going quiet around 11 o'clock? Oh, it's because their children have a break at that time from school. It's when the secondary schools break. They have tea break kind of concept. Oh, that's why she's never around. But if the line manager knew that and just said, no, I won't contact you between 11 and half 11 because I know you've got to switch focus to be with your kids for a bit because you're homeschooling, then that's fine. That's what we'll do. And I think it's just human to human understanding really of what different demands and pressures are on, particularly at this point in time while children are still off school. But I sense a new transition coming as children are going back to school. And as a parent, it's not clear cut how that's happening. I've got different children in different years. They're going to be different needs. And my line manager would need to know that about what's happening and thinking about, well, nursery hours, and I've now got between 10 and 2, normal nursery hours between 7 and 6, but I've now got a window of 10 and 2. So I think it's a constant evolution of dialogue as well. Of saying, okay, things are changing. What's the next step in this that you're going through? And planning for it and just making sure that everybody's really clear and expectations are managed all round. So everybody feels comfortable. And that's, I think, tying in with the productivity piece. You will maintain productivity levels then, because you'll have engagement, because the individual go, oh, this line manager's really looking out for me. They actually care, they're caring. They're not being overwhelming with their care, but they're nodding to it and going, yeah, I know you've got some stuff going on, and we'll accommodate for that, and we'll work it through.
I think also we need to be aware of our sort of language and assumptions within this as well, and just because people are at home making those assumptions that people aren't being productive, because actually what we see in lots of cases is that people are very productive and almost the opposite. So they're working really long hours because they haven't got the natural breaks in the office that they would have when someone comes over for a little bit of a chat or what have you. So it's understanding everybody individually, because you will have some people that do want to work between their hours of 9 to 5 because perhaps their, I don't know, the partner's gone out or what have you, and they want to keep their evenings available. So it's all very much on an individual basis. And I think one thing you'll hear a lot of as we kind of progress through these questions is the line manager's role within this is extremely key, and certainly the communication that they have with employees to really understand that will support this whole process going forward if it's done effectively.
Oh, thanks, Nick. I mean, we've got another question here which kind of flows on from that, and so the question is: does this in commas delay respond email technique potentially hide the problem? How can line managers proactively help with this?
Yeah, I think I meant it in the context of role modelling and being really careful about, you know, what your expectations are of your staff. I think when it comes to delay responding because someone's feeling really guilty, they haven't got their job done on time, or they're really worried about stuff, absolutely we need to understand that that behaviour. And I think that it comes down to understanding your staff more and their circumstances and what they're doing, and having complete transparency and openness about the fact, yeah, it's okay if it works for you that you're working between 9:30 and 11:30 every evening because of the way that your childcare arrangements are. That's okay. Write to me at those times. I won't respond most likely, but you can write to me at that time. I get it. That's okay. So I think it's about developing that trust between each other, and then there won't be that need to hide behind it.
Yeah.
So it's a question of how you're using the tool as a line manager, role modelling, or just detecting, actually, is there something else going on that I need to know about? And that might well be associated with other behaviours you're observing from your staff member. And that comes down to, you know, understanding some signs and signals of mental ill health, people not communicating with you generally, changing their behaviour anyway, noticing, different ways of doing things, and just picking up on your staff's responses.
Okay,
Yeah,
great. Thanks, Julie. So there's another question coming in now. Thick and fast, guys. So, okay, an employee has previously suffered from anxiety, and this situation is triggering their symptoms. What support can I provide?
Okay.
Who wants to take that one?
Yeah, I guess there's going to be legal connotations and clinical ones here, aren't there? I think if someone's already suffering from, has had a history of anxiety.
Oh, sorry, Julie, would you mind?
Which is absolutely.
I think we lost a little bit of signal there. Would you mind just starting that again? Sorry.
I can do.
Thank you.
Yeah, that's fine. I think from a clinical point of view, so understanding they previously suffered from anxiety and the situation is triggering their symptoms again. Certainly, I've seen that in my clinical practice. One definite presentation is OCD and people having an increased washing of their hands, of checking behaviours. We're seeing agoraphobia and panic. We're seeing those kind of coming out, that fear of going out of their house. I worry in the longer term we're going to start to see that more as people that are going outdoors with great trepidation. And I think it's about understanding, again, your colleague, sitting down and saying, right, what support do you need? And organisations like Mind have got a really good document called the Wellness Action Plan. And this goes to a question we had before around mindfulness and mental health tools. The Wellness Action Plan tool is fantastic. Basically, you sit down with you and your employee and you work out what their needs are, what you need to be looking out for, what they need to be telling you, how you can structure the working environment, how you can work together more closely, how you can help and support and monitor any any symptoms that might be exacerbating, and then you can also provide clinical support for them. So look at the tools that your organisation has. You know, do you have an EAP? Do you have PMI? Do you have income protection? You know, what sort of sources of support do you already have to access psychotherapeutic support? And just be really careful that you're getting the right level of support at the right time. That might well be that your mental health champions, if you have them, have picked up on this. And again, be aware that your mental health champions will not be intervening. They shouldn't be intervening. They should just be, you know, a reference point to say, look, I'm struggling here, what can I do? So having your kind of mechanisms of stepping up support from a clinical perspective is really important. So making sure you know what they are and that you can provide that information to them so they can access it really quickly. And some companies have 24-hour support lines. Other companies have 6 sessions through EAP. Other companies have opportunities for full-on CBT sessions. So it's really worth knowing what your resources are as an organisation. And again, it comes back to just communication. As a line manager, you will not be expected again to intervene and to provide that psychological support. But talking and saying, what do you need? What can I do to support you? Are you okay today? And doing more than just the "Are you okay?" Ask it again. Are you okay? And just making sure somebody's all right. That was a really long-winded answer.
No, it's very apparent, and I think what I would say from that is that the action plan can be used for all conditions as much as it's designed for mental health. If you've got somebody that you know has a long-term health condition or physical complaint that is ongoing for them that they're having to manage, you can use the Wellbeing Action Plan in exactly the same way. So really encourage you to do that because it's useful. It's useful for both the employee and the employer to just have that dialogue and to be able to signpost accordingly.
Okay. Yeah, and I think, you know, from the legal point of view, then I think now we're seeing more and more people, you know, as you say, exhibits or talk about anxiety or discuss their own feelings of anxiety, and you know, all the measures that Julie and Nick discussed there, you know, are relevant, you know, certainly very relevant to them. And then, you know, also thinking about those that's, you know, as Nick mentioned, about long-term conditions. So, you know, coming back to, you know, whether some of these individuals have a disability. So if someone has, you know, severe anxiety over a period of time, you know, a year or expected to last for a year or longer, and it's, you know, really impacting their day-to-day life, then those individuals will fall under the definition of disability from a legal point of view. And then all the things, you know, the measures that we talk about here start to also, you know, be the reasonable adjustments, exploring how to make those reasonable adjustments. You know, it's not a completely different thing. It's not, you know, a whole set of different ways of supporting them. It's just, you know, recognizing that there is an additional duty there. So exploring all these tools that we're talking about today and communicating with the employees, working out for each individual what their challenges are, how to support them, what resources are available to support them, you know, becomes, you know, it's fulfilling that extra duty as well, I would say.
Yeah.
Great, thanks guys. Okay, moving on to the next slide then. So I have a member of staff who is shielding. Can they still work from home? Yeah, so again, I think, you know, from a legal perspective, unfortunately, this is a fairly straightforward one that yes, they absolutely can do. And I think the question maybe comes from, you know, we've had it a few times from clients, and maybe the perception that you can't work from home as, you know, come from some misunderstanding, maybe because that people who shield are now entitled to SSP. So previously that wasn't the case, but a few weeks ago that changed. But really that is just where, you know, they are unable to carry out work from home. The government was just looking at ways that, you know, they could provide some form of income to those individuals and extended the SSP entitlement to them. But that certainly doesn't mean that, you know, people who are able to work from home, who just happen to be shielding, they shouldn't be, you know, asked to carry out some work from home. And, you know, again, it's about communication, the dialogue with those individuals, and to make sure that obviously they're fully supported and that they feel comfortable in carrying out that work. But, you know, as a starting point, then yes, absolutely they can do.
Yeah, it's certainly something that we would really encourage. We've seen this situation occur quite a lot with the number of our patients. So where we might have been working with them to get them to help support them to return to work, and then this has happened, and then they've gone off sick, when actually the rest of the workplace is all finding ways of working from home. It's really important, if we can continue to support these people to return back into their work activities, or just maintain work activities, we really encourage employers to do this, because we know that good work is good for health. So maintaining workability is really, really important.
Great, thanks, Nick. So the next question is, what adjustments to absence management procedures will be required in the light of COVID-19 sickness absence?
Yeah, I think this is quite a challenge for employers that have quite rigid absence management procedures, in terms of the documentation they require, the monitoring of absences, the trigger points that some employers use, the Bradford score, for example, and how does COVID-related illnesses, whether it's suffering from COVID itself or self-isolation, how do you deal with those new challenges? I think obviously we've got the change in terms of the evidencing of absence. That the government became very aware quite early on that it was, of course, going to be very difficult to get a doctor's note, as you would normally do, to provide evidence, and has got the new system of people being able to self-certify and going online and getting the self-certification notes to say that they are isolating in line with government and NHS guidance. So obviously employees have got to relax their usual rules about evidencing to incorporate that as a valid form of evidence. And then looking at the other side of how you deal with the absences under your absence management procedure, and of course usually that can lead to warnings if people go over a certain level, then you're triggering a capability hearing maybe and escalating through a series of warnings. I think some employers might decide that actually they're just going to completely discount all COVID-related absences from the Bradford reporting, if that's what's the way that they are looking at sickness, so that it doesn't trigger the next stage of the capability process. You can see, particularly if someone is on a final written warning for absences, and then they have to self-isolate, and the employer sacks them, that clearly does not look good. At the moment it isn't, that wouldn't be legally incorrect, because it's not necessarily a disability, but I would imagine that it could still very much be found to be unreasonable by a tribunal in light of the current situation. Of course, we haven't got tribunal test cases on this, but my view is that it's likely to be found to be unreasonable. So there's definitely got to be an element of discretion to be exercised there, and whether you're going to discount all COVID absences, and a lot of employers are doing that. And again, coming back to disabled individuals, some people with certain disabilities are, of course, going to be a lot more affected by COVID. So if they're suffering from it, they're going to be absent for a lot longer. And that, again, means that you need to think about what adjustments you're making to your absence trigger points. So you can't have someone who is, this is their first ever absence, but because they're disabled, they do have a disability, and they're off for, couple of months because of this. Obviously if we start disciplining those individuals, that is a big problem, and you have to look at how we're going to adjust the usual absence requirements and triggers to accommodate that. And obviously that's the case of understanding the individual, their conditions, and making individual adjustments. So it is something we'd need to take more specific advice on in individual cases, I would say.
Had a question. One of the things we see with just while I have it on my mind, I think one of the things we see when we're supporting people with long-term conditions back into the workplace, and thinking about the fact that those people who've had COVID are more likely to have multiple morbidities. So you've got people with long-term conditions and then having had COVID on top of that. Is we often come up against we've got a 6-week return to work policy. You've got to get people back in 6 weeks, and that might work for some conditions, usually acute. It just doesn't hold true with longer term conditions. So often when we're talking to people about cancer recovery and return to work, we're talking weeks, months, years sometimes, in terms of rehabbing someone to get back into the workplace and and functioning as best they can. So it's a question of bearing that in mind as well, of how fixed your policy is, because you were just saying, Matt, you know, if you've got someone who's had COVID, and we were talking about the rehab needs earlier on in this presentation, you know, that's going to take longer, and we've yet to even find out from a rehab perspective how that's going to play out. But knowing what we know about fatigue management and post-viral fatigue management and adjustment generally in mental ill health, that can take longer than you think. So you need to be, I think you need to build some flex in. Otherwise you could come up against trouble of like 6 weeks you've got to get back, because you'll have someone falling over. They'll be desperately trying to get back, and then they won't, and it will actually really impact on their confidence. And we've seen that quite a few times. So yeah, do you agree, Nick?
Yeah, completely.
Definitely what we say. Sorry, Rebecca, you were going to say something?
Yes, we've had a question come in. I have an employee on sick leave with stress, and she's caring for her daughter and grandson who live with her, and is asked to be furloughed. There is work for her to do, and we feel like this doesn't quite fall under the furlough description. Are we right to decline her request?
Well, I would say that, I suppose, the furlough description, one thing to highlight is, you know, how much that has broadened over the last couple of months since its introduction. Because, of course, when it first came in, it was, the interpretation was very much that it was that the employee had no work to do, and essentially it was an alternative to them being made redundant. Whereas now, you know, it's relaxed quite a lot, and, you know, essentially it captures any situation where it's, you know, it's difficult for an employee to come into work, or many situations, I should say, where COVID situation is making it hard for an employee to come into work, you know, and or there isn't enough work for them to do in the workplace. So I know, you know, a lot of employers in situations like this, where employees are finding it, you know, difficult to come in because of caring responsibilities, have explored furlough as a possibility. Of course, you know, if the employer does actually, you know, need the individual to be in work, and they're able to show that, you know, there's plenty of work for them to do, there's no one else to carry out that work, they're providing a safe place of work as well, then you start to be, you know, in a stronger position to, you know, to say that, well, actually, no, we're not sure that furlough is, you know, right in this situation. But I think these, and of course here we've got an extra element of the individual being on sick leave with stress. So, you know, again, it's a question about, you know, whether that individual is actually well enough to be in work anyway. And if she isn't, then of course, you know, there's the options that you can look at to support her for that. But I mean, a point I would just emphasise is that, you know, we see quite a lot of these questions, and, you know, it's very much the kind of working through the detail of it for that individual, and that there isn't a kind of one size fits all answer to this. So I think, you know, to look at it, you know, in more detail, and, you know, something that we could explore with you to see whether, you know, in this particular case, you know, it is something that we could refuse, I would say.
Okay, thank you.
Thanks, Matt. Okay, so the next question, again on the sort of furlough subject. I have staff on furlough, but I'm worried about their physical mental health. What should I do?
Let's start this one first.
Cool.
Shall I just mention, I suppose, firstly, just to say that, you know, people on furlough, the first thing to think about is that, you know, what are their particular concerns? You know, as we talked about throughout the session about, you know, considering what their individual concerns and challenges are, and trying to help them out with that, you know, whether it's childcare, or whether, you know, it's about not having the confidence about a job that they might be able to come back to, not feeling valued enough. They might think that, you know, they're being furloughed because they're not valued. They see other colleagues that are extremely busy. You know, some people are isolated. So, you know, I think, you know, as ever, it's about understanding the individual. And I think, you know, from a legal perspective, the key thing at the start is being very, very clear in the communication, in the written communication, about why the individual is being furloughed, and what's going on in the business, what has led to this decision, that it's not, you know, any sort of criticism or slight on the individual. And then, you know, having a discussion with them about that, so that they understand the reasons, hopefully, you know, reduces the concerns that they have, or certainly the, you know, the anxieties they might have. And then some of the things that we've talked about in terms of employee assistance programs, that they can have access to wellbeing calls in groups. I know that we're doing that across Freeths, with the groups of furloughed staff who can make suggestions to each other about how they're getting through this, giving tips. And then also you might want to think about what training individuals can do, because whilst of course they shouldn't be doing any work, because that would break the furlough effectively and compromise getting the grant, individuals can attend training. So if there is a concern about them feeling completely cut off and not being involved at all, then being involved in training is definitely something that we've found that can help with that. I don't know, Nick, Julie, if that's something that you've come across as well.
Yeah, definitely. I think we would really encourage that you remain in sort of contact with the employees and encourage that ongoing sort of dialogue and communication. We would do the same if we had somebody on long-term sick, for example. It really helps to facilitate that return back into work activities, whether someone's coming back from furlough or from a period of absence. So yes, absolutely, do that. And certainly your points around signposting, it's really important that you do understand what your organisation does offer. We very commonly go into organisations to talk to them about their wellbeing sort of strategies and resources that they have. And it can be very variable in terms of who knows what is available and what those services even really do. So definitely familiarise and push them out. But also, I suppose it's also ensuring that we keep all of this relatively light touch as well, in the sense that if people are demonstrating symptoms of kind of musculoskeletal discomfort or even just signs of sort of anxiety, that doesn't mean that they actually have a clinically diagnosed problem. And actually probably just staying in touch and doing all the things that we've talked about in terms of having routine in your day and staying active and socially engaged will maintain people's well-being. So it's just encouraging that element. Would you agree, Julie?
Yeah, definitely. I think what we want to try and do is keep people's mental and physical conditioning, as proximal as it was when they were working in the organisation. We want to make sure that so when they can go back into work, they can make that transition really smoothly. I was reading something interestingly recently, and it was talking about someone who worked in like a manufacturing environment, I think it was, and the person had been off work for 8-9 weeks. They'd become physically deconditioned because they weren't doing their heavy lifting, they weren't doing their twisting and turning and normal manoeuvring, because in that short period of time you can become quite physically deconditioned when you've been doing a very high, if I'm talking out of turn, Nick, very very physically demanding job. And so what we've got to think about is about an employer's expectations of that person actually being able to physically do that job just like that again. And it's about how you're making sure that person is physically capable to do the role when they return. And it might be some form of phased return you do, or some sort of light touch functional restoration program, just to make sure that actually someone gets back and they are safely able to do that, taking into account the physical deconditioning that may well have occurred.
Sorry, I was just going to say, and in terms of that, that communication piece, because the individual does need to take a responsibility within that. So if they know that their job is physically demanding, sitting on the sofa for 6 weeks is not going to support themselves to go back to work. So it's encouraging that and signposting.
Yeah, and just checking in and making sure that that's sort of happening. I think also you can see it from a psychological point of view, from a mental health perspective, but also just cognitive processing. People, how people's concentration skills may well have waned. Work can be very intensely cognitively demanding, can't you? You've got to be on your toes, you've got to be in meetings, you've got to be thinking things through, you've got to be thinking laterally, dealing with complex problems. That requires a lot of cognitive processing. And if you've not been doing any of that for a period of time, it's again, managing expectations of when someone's going back into the workplace, they might be experiencing more fatigue, more mental fatigue, not anxiety, but cognitive fatigue, and just building people's tasks up. And just it does keep coming back to the same thing, just making sure that line managers and their employees are talking and they're saying, I'm finding this hard, or this is okay. So everybody's on the same page, and that transition piece is managed really, really well. Because what we don't want is people falling out of work or going off for a period of time because that transition hasn't been thought through. But I think the first part is prevention. As Nick says, we don't want people lying on sofas for 6 weeks. So that's again a line manager. You okay? Keep your fitness up. What can you do? It's not just a question of that transition and getting back. It's earlier doors than that. And I think early intervention in this place and space is really, really important. And that's what we're trying to ward off when we're saying I'm worried about physical and mental health of someone on furlough. We want them to look out for those signs and symptoms earlier, intervene, support people. It's really important.
Right, thanks, Julie. So I guess this question sort of adds on to the last question, which is I'm worried about employee wellbeing when transitioning back into the workplace. How do we go about that?
Communication.
Yeah, I think we would probably encourage, as we would if we had somebody returning after a period of absence or illness, that we would utilise sort of phased return planning. Now, you know, I think it's going to be on an individual case by case basis, and so some people will very easily and naturally sort of return back into the workplace and others won't. So I think it's just thinking through their individual needs, their expectations, and then working with them. Again, seeing being flexible from both parties is really, really important. So, you know, maybe thinking about a combination of both working from home and going into the actual workplace if you know, that's what the organisation is deciding to begin with, and gradually introducing it. But keeping the dialogue going, thinking about anyone with health concerns and utilising the wellbeing action plans to support that, encouraging signposting, but it probably tips forward also into thinking about getting organisations to think more about their overall wellbeing strategy and actually what's the ongoing wellbeing messaging that the organisation can put out around, you know, staying relatively active during the day. How much exercise are we generally doing? Are we sort of talking to one another and accessing support services as needed?
Yeah, and I think, you know, from our side, then we always, you know, have seen that, you know, clients that are more proactive with these measures and, you know, thinking about well-being, you know, always tend to, you know, be more successful in that regard rather than waiting for problems. You know, concerns to arise, and hopefully, you know, this is something that, you know, is almost an opportunity that, you know, when people are coming back and, you know, we are all kind of talking about well-being and focusing on it, that employers kind of, you know, pick up these habits and keep them going, you know, as people are getting back into the workplace, because obviously that's much better for employee well-being, and then from a legal position as well, it's always better for protecting the business and, you know, taking those more proactive steps as well and fulfilling those legal duties.
Yeah, I think going alongside this is also managing your own assumptions. So, for example, there are lots of people who want to get back to work. They don't want to be working from home anymore. So I should say that they want to be working back in the office again. They don't want to be working from home. So it's like whatever your assumptions are. So mine might be, crikey, I don't want to go back into work because I'm really worried. How is my employer going to make sure there's 2 meter desk distance? How are we going to manage what isn't hot desking but might end up being hot desking? How's it all going to work? I might feel really anxious and I might project that anxiety on everybody else and assume that everybody else feels the same way as me, and they won't. There are people who are much more maybe chilled out about the whole thing. They know that what the rules are, they follow the rules, they're going to wear their mask, they're going to wash their hands regularly, they have complete trust in you as an organisation that you're going to do what you say you do in terms of COVID security and safety. They're fine. So it's really challenging your assumptions around what you think their needs might be, and what you think they're thinking, because often, I mean, you get people with curveballs all the time going, oh, I didn't think you'd think that. So it's just checking that out really with that transitioning piece.
I had a question come in actually, saying, I have an employee who does not want to return to the workplace. Can they refuse?
Yeah, I think we've had a few queries like this, and, you know, I suppose some employers can be, you know, a little too quick to kind of want to kind of look at disciplinary procedures for any sort of refusal in any context. And of course, you know, in a situation like this, you know, that's not really going to be shouldn't be the first port of call, really. And I think, as we've been saying, the first step should always be to understand the particular reasons for that refusal and what are the situation with that employee. Of course, if they're unwell, if they're shielding or isolating, then that's pretty straightforward. If it's that they've got caring responsibilities, or maybe they've got concerns about the commute, again, do we look at furloughing or continuing to work from home? If it's about the commute, is there something about staggered start times that we could look at to ease that? And then, going forward into what actually the reassurance, I suppose, that we can give people about the workplace, then, we need employees to be very clear that actually, we're doing everything as employees that's possible and, required to make it, as safe a place of work as possible. So, carrying out a risk assessment in the workplace is required, and there's a lot more information about that on the Health and Safety Executive website. That's a really useful tool to carry out that risk assessment, discuss them. That needs to be done, with engagement with employees as well, so that they can, understand what's been done. Any employers with over 50 employees should be sharing that on their website, and other employers are encouraged to be transparent about it as well. And then, thinking, obviously, social distancing is a big topic which we could spend a lot of time talking about, and every employer is going to be different in terms of how they can manage that within their workplace. But clearly thinking about that within the risk assessment, communicating that to the employees so that they're comfortable that has been factored in. Obviously, encouraging employees to think about washing hands, ongoing points about washing hands, cleaning, regular touch points, and all these things start to mean that you've thought about alternatives for them to maybe remain working at home or be furloughed. If that isn't working, then they've got to come into work. You've thought about all these ways to make it as safe as possible, reassured them, and if at the end of all that the employee is still refusing, then and only at that point, I would say, you start to think about, well, actually, is this an unauthorized absence from work now? If we've been completely reasonable, explored everything, are they failing to follow reasonable instruction to come into work? But as I say, there's many steps to go through before you get to that more kind of, disciplinary type point.
Great, thanks, Matt. Okay, so moving on to the next questions, I guess, is should we maintain working from home / agile working practices? What does this mean for how we manage employee wellbeing going forward?
Yeah, I suppose if I just start just with a sort of brief flag about a legal point here, which is that people have before all this situation already had the right to request flexible working, which has included being able to request working from home. So any employee that's got over 6 months service with an employer has had that right anyway. I suppose the big impact of this is going to be that where employers were often quite reluctant to consider working from home and would just say, well, it won't be as productive, it won't work, therefore I'm going to refuse. Of course, within the flexible working regulations, of course, what's happened now is we've had the biggest, longest trial period of home working you could possibly imagine. No one ever thought we would have this. So if you're an employer and you're reluctant to allow flexible working or home working going forward, just be aware that if the evidence has shown that actually it works really well, then you're going to be on fairly shaky ground in terms of the refusal there and potentially breaching the flexible working regulations. So there will just have to be a bit more thoughts given to that. And of course, make a positive about that, because of course if it's working well, then great. And some employers have already looked at how that might be incorporated into working going forwards, and employees of course like that more and more from an engagement perspective and retention and attraction of talent, that if you're able to offer these kind of options, that's generally great for an employer. And I think the only other thing just to signpost is that there has been some talk in the press about a potential new law or the rule being enshrined or the right being enshrined about being able to work from home. At the moment, that isn't the case, but it's something that, of course, we will keep an eye on, and if it does, if and when it does come into practice, it's something that we'll talk about in future sessions. But for the moment, it's very much looking at it within the existing flexible working rules, I'd say.
Yeah, and I think from our perspective, from certainly looking at a wellbeing perspective, just to build on some of the points that Matt's raised there, I think it's an opportunity. If you have already had in place that you've got regular communication and dialogue with your team, this is going to make this sort of process a bit easier, but it's actually bringing the employees into part of the decision making with it. I would actually really encourage organisations to be perhaps even putting a survey out, an evaluation of the process. What bits have worked really well for people? What bits haven't worked so well for people? You're going to get a divide. Some people are going to want to be in the office, some people aren't. So it's trying to really understand from the workforce what has been useful and what hasn't, so that you can then look forward in terms of how this would be managed. We had a discussion with someone recently who was working from home all the time, but the rest of the team was in the office until this situation occurred. And then since lockdown, she's found working from home much better, because actually there's been lots more interaction. There's regular team meetings where everybody's joining, whereas before she was the only person. So if there is a decision to go back in, but there's some people still working from home, it's taking some of those sort of learnings and making sure that they are sort of continued. So certainly in terms of agile working, it's also very, very useful, and something that we would encourage if we are supporting people with long-term conditions and trying to support people back into work after a period of absence through illness as well. So for us, it's actually been a very useful thing to have, because we've probably been able to get more people working quicker than we would than that kind of commute into work is a barrier to a lot of people that are suffering with pain or fatigue or low mood. Yeah. Would you agree with that, Julie?
Oh, without a doubt. We just don't have that obstacle of you have to be in the office. And actually people have shown they want to work. So when we've heard people say, I really want to work, my employer doesn't want me to because of the office, you've always wondered what's the dynamic there. But we've seen actually a surprising number of cases said, yeah, I'll give it a go. Even people who are shielding in that category, so they've been very unwell, they've had chemotherapy, they're on really quite strong drugs, medication, and no, I'm okay, I can work, I can do this. And now my employer has to give me that opportunity because I know other colleagues are working from home and I can work from home. This is great. This is really helpful. And so we all helped, we will often use working from home as a way of transitioning people back into the workplace as part of a rehab plan. And we're just seeing that that's being more operationalised now. People actually are back at work and managing their long-term condition at home. And that ties me into thinking actually about quality of life, an individual's quality of life. And to your point, Matt, about how an employer can seem a really great option because they have these sorts of, as they are looking out for staff in the way that they might want to work. And we've heard of people working from home and could move up north even though their offices are in London. So they've been able to have the really high powered job that's London based, but they can be working from home where their family is for childcare support, for example, and it's worked really brilliantly. And you've got a very, very engaged employee who's very motivated, believes passionately in the company, and they're going to be very dedicated to the cause. So I think it's quite an interesting perspective, this quality of life one, and how that frees up the health benefits. And to Nick's point around the commute, if you haven't got that commute of an hour and a half in some cases, you could be exercising, you could go and do stuff. Suddenly you might have some freedom in your time. When things revert again, you could go to the gym between 9 and 10. 8 and 9. And then it changes the whole way you look at life and look at the world. So actually it's going to be really interesting times. And again, just keep talking. What are your people's needs?
I think also in terms of the second question, then in terms of what does this mean for employee wellbeing going forward, I think it's a really, really exciting opportunity and it's time for businesses to embrace employee wellbeing. I think the first time really that this situation has put health and work completely in the same place at the same time. within that context. So we can sort of build on this and actually take so many positives from it and use it as an opportunity now to say to people, okay, so actually you've said working from home, it's been great because it means you've been able to exercise. How do we then continue to embrace these things? Or that it's made line managers think about communication skills more so because they haven't got the ease of just having somebody in front of them. So it's allowing us to think forward really in terms of that overall strategy and the different elements of the strategy. So looking at, for example, as an organisation, you choose to have a series of resources, an EAP or PMI, but actually, do you know how many people are using those and how effective they truly are? How effective has your occupational health been during this? Do you need something that is going to be perhaps more involved and more work focused? So take it as an opportunity to explore what has worked and what hasn't, and allow that to then feed into the overall strategy. Would certainly be my sort of take-home points from that going forward.
Well, and collect data. Start to actually actively collect data. We've worked with organisations and we've asked the question, you're setting up a wellbeing strategy. What's your absence rate? Why are people going off sick? Because that would give you an indication of what you need to be changing at the wellbeing end of things. And often it's like, don't know. I don't think we collect absence data, or I certainly don't know who my counterpart is in the absence section of our HR team. It's quite phenomenal. Wellbeing can be actually in a completely different, separate part of the organisation, and the two sections don't talk to each other. And I think they need to start.
A really important point that we often talk about in these sessions and with clients about how wellbeing does feed into everything really. And of course, during this time as businesses, I think every employer's got challenge, economic challenges as well. Of course, we talked at the beginning about potential redundancies. I think every business is affected by this and is worried about the finances. And there is a very clear link there, isn't there, about maintaining the well-being of the staff, obviously from a positive and a supportive point of view for the employees. And then also, thinking about your businesses and your organisations as well, because coming through these difficult and challenging times, you want a productive, motivated, engaged workforce to be able to help you through that. And in that kind of dynamic, then it's a positive thing for both sides, I would say.
Yeah, and we know if we maintain a healthy sort of employee population, then that will have a positive impact on productivity. So really, it's a win-win situation for everyone. So it really is making the most of the opportunity rather than seeing this as a challenge.
And the caveat that I would add there is, if you are going to start to intervene, make sure you've got some really good quality evidence-based interventions at a wellbeing end of things. Making sure it is actually what your people want and need, but actually what you're providing is solid and evidence-based.
Yeah, so you continue on with that evaluation really, so that you know that it is being effective.
Yeah, totally.
Okay.
Great, thank you. I think now that's the end of our questions.
Yeah, okay. So in terms of a summary then, if we just think about some of the key themes that we've talked about, really it's trying to establish, we're establishing this sort of new working normal, and it's working through that. We've very much touched on the importance of the line manager's role within this. So if it's of a concern to you as an organisation, it's thinking through the training of line managers, certainly in terms of communication skills, particularly in relation to having health conversations. Do they feel comfortable to deal with this? Now, this doesn't mean that these people need to turn into doctors or physios or psychologists. They just need to be able to ask a question and know how to signpost. So definitely thinking that through and supporting them to be able to have that. It's looking at that proactive management of health and well-being, so doing that from the start and keep on going with it. And certainly engaging employees and the employer within the whole sort of process really, so that it's a combined effort to make sure that what we have found to be effective and what hasn't, we work on that and build on it. And this is a time for both organisational and cultural change, so let's really optimise on that as an opportunity. But most importantly, importantly that we underpin all of this through strong evaluation and the use of data, both to understand what the need is, but also the ongoing effectiveness of what we then put in place as well. Okay.
Really.
Yeah, absolutely. So if there are a couple of really useful resources for you to have a look at that are touching on all of these different topics that we've talked around in terms of employee wellbeing. The CIPD have got quite a number of nice sort of tools that you can utilise for that wellbeing perspective. The SOM have just brought out a toolkit. It talks more around kind of the return into the workplace and the sort of health and safety perspectives that you need to be thinking about that from both an organisational and individual perspective, as to of the HSC. HSC have also got some really nice, the management standards are really useful for people to explore if there's any issues around sort of how they feel within their role and the demands being placed on them. It's a nice tool to use during this process. The VRA have got some, and ACPO have got some very specific stuff around sort of vocational rehabilitation, and ACPO coming from that kind of musculoskeletal physical perspective, the advice and guidance of working at home, but also there is some guidance coming out around the rehabilitation for both generally for deconditioning, but also for those with COVID. And then Matt, you've put in a couple of these resources.
Yeah, I just wanted to highlight about obviously the government's websites that is constantly changing in terms of the guidance which has been given on coronavirus. I think we were finding as lawyers, of course, in the first couple of weeks, and just trying to keep up with that just each day. It seems to be shifting, so that's always a good one to check, and particularly in the context of what we've been talking about and people getting back into the workplace as well. The sector-specific guides that have now been put on there in the last couple of weeks, are particularly useful depending on what sector your business is in, and how to set up for that and support employees back into the workplace. ACAS, as ever, is a useful resource for employers, and they've got some specific pieces of guidance around some of the points that we've been talking about today, home working and supporting employees back into the workplace. So always good to check in there to see what guides they can offer to you, and all free.
Yeah, I mean, two others that are also springing to mind, which the two we mentioned right at the beginning to do with research evidence, is the Institute for Employment Studies and Stephen Bevan's work and his team. There's lots of really interesting and very useful work that's coming out there, and particularly in terms of well-being and productivity and the link between the two, so that as a business you can start to see the return on investment of having really solid well-being strategies. So keep an eye on that space, and also have a look at the ONS data that's coming out, because that could inform your practice too. And then organisations like What Works for Wellbeing and Business in the Community, there is some really interesting research papers and evidence-based stuff. Just have a read and just see what inspires you to get going on this sort of approach of wellbeing and productivity, and engaged workforce and a healthy workforce.
Yeah.
And we also just wanted to highlight, obviously you've got in the slides the details about the Freeths Coronavirus Hub, so you can go to that, and that's been a really useful resource for our clients and other organisations to go to the website and see, particularly things like the guidelines that we give, the FAQs. I think that's probably be a massive help, where we gather together and we talk about the questions that we're getting most frequently coming in from clients, put those on the website and give some broad guidance on those. And I know a lot of organisations have found that very helpful during this time. I would just say, of course, with these sorts of situations, then we can only give broad guidance on there, and lots of the COVID types questions, like the wellbeing matters we've talked about today. Each individual has got their own concerns, anxieties, or physical difficulties and challenges. So of course, often we'll need to kind of go beyond, some of the sort of standard answers and the guidance, the broad guidance we can give, and discuss with you in a bit more detail, if you've got specific queries, and obviously got our contact details on there. And I also just wanted to say that thank you as ever to the Chamber of Commerce, who we always partner with in these sessions. And I know that, you know, as ever, they provide a huge amount of support to businesses, to their members, and particularly at the moment, as you know, you all, I know, have got, you know, your own specific challenges, but, you know, more challenges probably than is usually the case. And the Chamber of Commerce have got a lot of resources and support that they can give you. And the contact details are there on the slides that you'll have a copy of. But finally, I just wanted to say thank you to everyone, to all the attendees, that's all of you today, for joining the webinar, and we hope you found it a useful session, giving you some of the rules and guidelines, but also practical guidance, tips, you know, about managing some of these wellbeing issues and how you can, you know, take some of these points going forward as well, you know, as a positive, really. And, you know, thanks to everyone that submitted questions. So, you know, both before the session that we had some coming in, and then it's been really good that we've had some coming in during the sessions today. So, you know, hopefully you found that helpful. And as I say, you know, I know that we're not able to answer absolutely everything about such a huge topic in 90 minutes, but hopefully it's a good starting point, and you've got our contact details on there in case you want to ask any of us specific questions, you know, coming out of what we've talked about today, or anything that you feel that you want to talk about that we haven't been able to cover. Thank you.